who is going to be talking with us about this moment that we're in. Right, we've titled the episode Two Truths and a Lie, Public Health and Medical Misinformation. And the idea behind this episode is really to get a sense of what are the things that people are struggling with? What are they hearing? What are they wondering about? And how do we come at this as a community of academics, of misinformation researchers, of people who are thinking strategically about how we are going to handle this moment and get through it together. And I'm just going to share these slides here because there's a little bit of housekeeping that we're going to have to get through. This is being put on by the Technology and Social Change Research Project at Harvard Kennedy Shorenstein Center. I'm your host, Joan Donovan. And as you can tell, we are really trying to bring you up-to-date, in-the-minute information about misinformation as it develops. So this is a webinar, so there's no attendee audio or video available, so feel free to do whatever you need to do. Oh, the slides are too small. Okay, what I'll do is I'll do this. I'll just leave them as this for now. I think that might help. I'm your host, and you will get a copy of these slides if you registered for the webinar, so you can read through about the kind of research that we're doing. And from there, today's episode is going to be, for some reason my computer is going absolutely crazy today. Really about this moment that we're going through. I'm going to shut off these slides because I feel like there's something going on with Zoom. So we will forego the slides for now. So we are going to jump right into the conversation. Today, when we think about medical misinformation and public health, we are working with a model of risk communication and of really a strained information ecosystem. The internet really hasn't been built for a pandemic. It hasn't been built for giving timely, relevant, local, and redundant information, which is what everybody needs in this moment. So we've had to really start to devise and stretch our communication capacity to do something different in this moment. And I want to go to you first, Ashish, to talk a little bit about what it's like to be someone who is doing primarily public health communication in big market media at large cable stations. You know, can you give us a sense of your day-to-day? I know you go from interview to interview to interview, but what is that like? Let us know a bit about the slice of life that you're facing, trying to get people to understand more about what the medical implications are of COVID-19.
Organizing this. Yeah, so saying thanks for having me on. You know, there are a couple of things. I mean, one is, as an academic, I don't want to spend my whole day going from interview to interview. There's a lot of work to be done, and a lot of important analyses to be done, and a lot of writing to be done. And so for me, one part of the challenge has been to think about what is the best way for me to effectively deploy myself in this. And some of it is I need to do academic work to try to actually answer some important questions. But also, when I look at the communications that's happening out there, I feel like I am doing something useful by engaging with the media as much as I have. So there are definitely days when I feel like it's too much and I have to cut back. So I'm trying to get that balance right. What I find interesting in the engagement with the media is a lot of times I can feel like I know where the story is, where we're going to be talking, what the issues came up from. And then sometimes I just get blindsided by some topic that I didn't see coming. And those are always, to me, the most disconcerting, because I'm like so in the weed on things that I think I have a sense of what the big issues are. And, you know, and some of the examples are the kinds of questions I will get asked about, the president's been talking about hydroxychloroquine. And I remember when the hydroxychloroquine stuff broke, and actually I started getting asked about it a little before it broke with the president, and then got asked all the time. And I could not wrap my brain around, why are we spending so much time talking about hydroxychloroquine? Like a month ago, I would have said, maybe, like probably not, but might be, like we should look into it. Like there are probably 30 other choices that are better, but it could be number 31 on the list of options to look at. And so one of the things I've come to realize is 90% of the times I have a sense of where the thread of the story is. And then the 10% of the times I have no idea and I've gotten blindsided. And it's obviously very disconcerting, especially when you're like on live national television and you don't know that that's coming. And I struggle with it. And maybe one last part is at least some chunk of people who've asked me questions about these things, whether it's on NPR, call-in shows or other stuff, don't really say, what do you think about hydroxychloroquine? They will go after me as, you're part of the guild that is old school, doesn't really understand how the world has changed. Why are doctors anti-hydroxychloroquine? Why don't you want to save lives? And so it's much more of an attack than it is hey, what do you think about this? So that's also very interesting and something I struggle a lot with, because again, I generally feel like I don't see those coming when they come in. And so a lot of what I've been doing in the last couple of weeks is trying to figure out how to be more effective in responding, not taking it personally. Also not trying to repeat bad information, but try to correct it with good information. But it is, anyway, so probably more than you were looking for, but it's a bit of a struggle.
Yeah, no, I can imagine. And Setti, some of the things that you've done in your many prior posts in government prior to coming to Shorenstein has also had this moment of failures of communication flows where you're really expecting one thing, or you're trying to triage a problem on the ground in your city, and then you just kind of get blindsided by something that happens in either the national media or from the national government. In this moment, how do you think governors are handling information that is confounding? Do you have any examples where governors were like, we didn't expect it to go that way? Because in my mind, I'm thinking a lot about the bidding wars around ventilators and how governors were bidding against each other's states, and the federal government had started bidding. And so the whole process of buying medical equipment had created this unneeded internal competition. But from your experience, what are the consequences of those kinds of breakdowns? And if you have any examples that have come to mind, I'd be really interested in hearing them.
Sure. Well, I think it depends on the governor. Just two examples that are complete 180s. You've got Governor Baker here in Massachusetts, who for the last several weeks has been very responsible and thoughtful and attempting to get PPE, attempting to do social distancing and have people stay at home. I actually had a very thoughtful conversation with him a number of weeks back to provide some information on the ground for him. You take that versus Governor Kemp down in Georgia, who has not been in touch with municipal leaders the way Governor Baker has made the decision to open up without consulting really anyone, but I think the federal government and the president, and actually telling mayors and across the state of Georgia, we do not want you in any way to keep closed, and we're going to override your decision-making process. So I think you're seeing a real difference between states, governors, and how they're approaching this. And I think that's very unfortunate. I'm not, Ashish is the medical person, but when you have an uneven response to states, you have an uneven response in the United States. I mean, you take Governor Cuomo, who has really put together a number of different governors in and around the New York area. Very smart, Connecticut, New Jersey, and so forth. And they're making decisions together. Governor Murphy, and that sort of tri-state area. So I think that you're seeing different responses, different policies, and I don't think that that's good for the overall health and welfare of the United States.
let's dig in a bit to Georgia, because this has been something that's on my mind. The past weekend, we saw these reopen protests where if you watched any of the footage from some of them, people were live streaming, of course, to YouTube and Facebook and Twitter. People weren't social distancing. They weren't wearing face masks. They were chanting things like "Fire Fauci." That to me signals that there is both a crisis of governance and mistrust in the scientific data. And there's a tension in misinformation studies around, talking with Kate Starbird from UW earlier this week about this. There's a tension between getting people to think critically and then getting them to understand that this is different in this moment, and that because of scientific uncertainty, the political decisions need to be guided by science. But if you don't trust the scientist, you're not going to trust the science. The other thing I've been thinking about in a strange way is how Georgia might, if they do reopen too early, might actually become considered a natural experiment. And as public health tries to grapple with what the next wave of this might look like, Ashish, how are you thinking about what might happen in Georgia if they reopen too soon? And how might that change the models and the data that we're using to make sense of this as a national phenomenon versus a local phenomenon?
Yeah. There are a couple of interesting things on this. So first, there are just so many intricate interplays here. Let me just try to lay out a couple of them. One is that the model that the White House has been using to predict what's going to happen is the IHME model, the one from University of Washington, built by Chris Murray and folks. And it's not wrong, it's also not right. And now let me explain what I mean. Like, there's nothing kind of scientifically wrong with the model, but it essentially assumes complete social distancing through the end of May, right? It says no one's getting out of their house and maybe just going for a walk, but that's it. Nothing else until the end of May for the entire country. And based on those models, everybody looks like they're going to come way down over the month of May and the number of cases will be very small. And whereas a lot of people, a lot of political leaders have looked at that as not a model of prediction under those circumstances, but just a model of where the disease is going to go no matter what you do. So a lot of people have said, see, we're going to be at very few cases anyway, let's go ahead and open up. And that has been very, very problematic. And actually, there's some specific problems with the model that really exaggerate how quickly a decline there will be in cases. So I actually think it's a serious problem of the modeling not being explained in a way that political leaders understand. And then, of course, if you're very motivated to open up, you can point to the model and say the White House's model suggests we can probably open up. So that's one set of issues. The second is, this is a new virus, and there's a lot we don't understand. Now, there's a lot we do understand, right? So I want to just be very clear that, like, no one is confused that if you open up more, you're going to get an increase in cases. Like, that's just biology. But I do think Georgia is going to teach us a lot about how long does it take for the resurgence to start getting picked up again when you start at a pretty high level. When do you get to a point where you have no choice but to have to shut down again? All these things that I talk about and I worry about, Georgia is actually going to teach us all of those. And does it mean that we could be off, some of our models and expectations could be off by a little bit? Sure. But my general feeling has been that I don't want the experiment on the people of Georgia. Like, what I'm very worried about, the high likelihood is a lot of people are going to get sick and a lot of people are going to die. And yes, that'll make our models better. But I'd rather have our models have a lot more uncertainty than to have to experiment with Georgia in this way.
And so, Setti, the question would be about governorship here. I'm thinking back to the Occupy protests and the way in which there were waves of raids that played out in removing those camps. And so it was sort of like there was a hyper focus on Oakland for a while, and city mayors were getting on the phone with one another, doing conference calls saying, hey, we hit them in the middle of the night. There wasn't a lot of media coverage, and therefore, we were able to clear them out and there wasn't this residual reputational harm to the city for acting pretty violently in some cases to remove protesters. And in thinking about how other governors or mayors might react to what they see in Georgia, how do you think people, different states are going to react? Are we going to see a red state, blue state divide here? Are we going to be dealing with hyper polarized decision making that is potentially putting different populations at greater risk?
Yeah, I think, you're going to just see different responses based on who that governor is, who that mayor is. I remember, we used to plan for all sorts of different challenges in Newton. We had different types of protests around issues at City Hall and otherwise and we've spent quite a bit of time based on the intelligence we got from our police to do planning, de-escalation in some cases, and contingency planning. And we just spent days and hours with our team to do that. You're going to have some governors that actually put a lot of time in that. They're doing it now based on seeing what they're seeing across the country, based on the intelligence they're getting on the ground. And you're going to see other governors that don't and that decide to go another way. I think this is a particularly dangerous question, a dangerous time, Joan, because of what you saw in these different places. And, it was a national effort that was being made to promote these protests. And you combine that with what's happening to people. People are hurting out there. They're going to lose, money. They're going to run out of money if they already haven't. They're going to, the food pantries are exploding everywhere right now. There's basic medicine and otherwise that people need on a day-to-day basis. So my concern is at the local level, particularly on the ground, what are the resources, not just planning against protests and things, but what are the resources local municipalities going to have to take care of their citizens? So it's a real concern of mine. And when there's a logjam and you don't see money coming in for states and local government, that's a really serious problem projecting out in the number of weeks and months, because municipalities can't print money and they can't run deficits, and they have to pay payroll, they have to pay debt service. So those are real concerns of mine, mixed in with these types of outbursts and protests. You can see real problems at the local level.
Yeah, and before we saw the coordination that happened this weekend, in our latest Meme More Weekly has been about these reopen protests and the kind of memes around the First Amendment is my permit. There seems to be, pain, right? There's very much pain. Financial pain is causing people to want to protest. It's not necessarily an activity that people do lightly. It's not for fun, right? And so people are expressing a serious, distrust and dissatisfaction with what's happening in the moment. But at the same time, when we start to see the names, the things start to consolidate through Facebook pages, you start to see a groundswell of attention towards a particular hashtag, then we know that something is coalescing into a movement, but then also might be an artifact or potentially have some coordinated behavior behind it. And so when we started to dig into the evidence around these reopened protests related to who was organizing them, you actually find a very strong network of gun rights activists, right? So below that is a political movement that is, sort of shifting their issue and shifting their focus it's in order to highlight this particular issue. But then the other thing that we've been very concerned about as we look at these reopened protests is the medical misinformation that is undergirding the idea that you can go outside and be with one another. You don't have to wear a mask. You don't have to socially distance. Or if you want to, right? There's this like talk of if you want to. And then there's a couple of particular conspiracy theories that we're seeing floating around. Ones that are particularly troubling, I would say, is the virality around Bill Gates and his work on vaccines, where people are sharing that alongside a article that is suggesting that Bill Gates is also going to be injecting microchips into people. And so when we think about misinformation, Ashish, this is something that we wonder about, is when we see the rumors start to get traction online, really it's only a matter of who says it and are they in Trump's orbit. If they are, then it might get said at one of these pressers. So when we were tracking hydroxychloroquine, for example, it had started with some Bitcoin investors, had gone through Elon Musk, up into Fox News, and then the next day Trump was tweeting about it, and it was in his press briefing. But the interesting thing is that other treatments, other clinical trials were actually more popular in online discourse. I think I'm pronouncing this right, the remdesivir. Yeah, that one was actually more popular in dialogue online until Trump and others had started to mention this treatment.
Interesting.
So these are the kinds of things that we study as we study these pipelines. So we were just doing a deep dive into this Bill Gates vaccine microchip story, and it actually has been around for about a month now. It was first in a video that's been viewed nearly 2 million times on YouTube, right? And so for us, it doesn't appear out of nowhere when disinformation is going to show up in the media ecosystem. And so I'm interested in knowing more about your interactions with the media as a result of being a sort of a public health communicator in this moment. Are there gaps where you think journalists should start looking for different and better stories about public health that aren't necessarily revolving around what we would call quote unquote lurid curiosity?
So one kind of side point, just because we've been talking about those protests, is on Monday I was on BBC World News with against Adam Brandon. He is the head of FreedomWorks, and they were the organizers. And he was very clear. He's like, we organized those protests this weekend. And then very interesting. So he says, we asked everybody to stay in cars. We asked people to socially distance, not to put themselves or anybody else at risk. And he made a very kind of compelling case for why this protest was well thought through from a public health point of view. And it was just, anyway, that was interesting, right? Because he was not like just saying all this public health stuff is junk. He was saying, I'm with the public health people. We do need to be doing social distancing, and our protests are social distancing kind of, heavy or whatever. You get the point. So I thought that was pretty interesting. So your question about, are there other stories that people should be doing? Like, first of all, I mean, what's really remarkable to me, and I've never seen the media like this, and I'm sure you guys haven't either, is like almost everybody's working on COVID, like almost every journalist. There are like 4 or 5 journalists at the New York Times that I'm used to talking to, and I am discovering a whole new group of them, and they are like journalists who work in totally different areas, but now they're working on COVID because this is the issue. So on one hand, there's this really remarkable shift of the entire media industry towards, well, the biggest pandemic of our lifetimes, and that makes sense. But it does feel to me like not enough attention still gets paid to the science issues that really have to be driving policy, and the disconnect between science and policy. And a lot of it still gets framed into the the competition in views. We want to give you the alternative. We want to give you both sides. And journalists love talking about both sides. And like one of the most kind of egregious examples of this for a little bit for me was the New York Times ran a series of op-eds by people who understood nothing about infectious disease epidemiology, who were really making up, like who were just writing stuff that was wrong, essentially to create the sense that like we're all overreacting and this is really not a big deal. And I just remember thinking, like, why the need to feel like there are two sides? Because sometimes there's just one side, and there's multiple sides to how you respond to that policy. But maybe sometimes on the science, there are two sides. And what I have found is a remarkable degree of consensus among people who actually understand the science of this disease around what the fundamental issues are. And then disagreements about trade-offs and policies. And those I'm happy to see covered by kind of in a two-sided way. But the idea of covering the science in a two-sided way on areas where there really isn't any disagreement has struck me as very, very odd, and it keeps coming up over and over again. So I don't mean to beat up on the media, and I actually think in general they've done a good job on this, but that angle has struck me as odd because it's kind of like, well, you know, you think the world is round, but other people think it's flat. Like, no, like, let's not have that debate. Let's talk about what we're going to do given that we all agree that the earth is round, right?
Mm-hmm. No, and that's something that comes up quite a bit when platform companies are trying to adjudicate takedowns and what counts as health misinformation or political misinformation. And for us, you know, the example of the earth is flat is an important one because algorithms, search and social algorithms, are built to surface fresh and relevant content. They're actually not built for authoritative content. And this has been something that platform companies have really struggled with because it's not like going to the library. Every single day, search results, or even every hour or minute even, search results are going to change. So the same keyword is not going to bring up the same information 2 days from now. And so when it comes to serving up misinformation, the manipulators really have the time and the algorithms on their side to get something out there, let it ride for 12 hours, and then it gets taken down. But the residual artifacts of it or the behavioral change is already there. But to your point about two sides, I think Setti probably knows this as a politician better than anyone, right? Is it comes from a world in which, you know, we have to be objective. We have to be mindful of the political sphere around things. And so reporters get trained on both sides in order to appease this idea that the media needs to be objective. And then if you become known as an advocacy journalist in some circles, then that's considered, less subjective. But Setti, as you start to think about this in terms of politics, what kind of damage does this both sides journalism contribute to the overall pandemic or infodemic that we're going through, particularly around these political red state, blue state divides, where if the governor is going to override the mayors, we're going to be in a lot of trouble if you can't think about location as location and the data associated with it as the mechanism by which you make decisions.
I think it's incredibly dangerous. And, we're talking about people's lives. As you were talking, I remember, and I'm sure a lot of people on this call remember during the Boston Marathon when one of the bombers was in and around our community, and the governor asked each of the localities to issue shelter in place. So I, at 6 o'clock in the morning, got the message, told my police chief we're going to do it, put a robocall out and told everyone shelter in place. Now, there was no one saying there are two sides to this. Maybe you could go outside and there wasn't a danger. There was no two sides. So I think we have to treat this for what it is. It's a life-threatening thing, and we need to follow the science And then we need to put protocols in place to protect people, just like we would if there was another type of threat, the way I described. And local officials of any state, whether it's red or blue, could also get confused, right? They could get confused about the information if they see there are two sides to the argument. I could go one way or I could go the other way. So, and I've been talking to local elected officials in the last week or so, and I still talk to them. They're still trying to figure out what steps they should put in place moving forward in the next several weeks. Newton just, and I mean, obviously Governor Baker said, we're not having school, but, moving past the spring into the fall, what are we going to do with the schools? And so then again, you have these, you can't have both sides. It's either safe or it's not safe. If it's not safe, then you have to put protocols in place to protect people.
Ashish, go
Can I
for
jump
it.
in on two quick things?
Yeah, of course.
One is, so what's interesting is thinking about the two sidesism of the pandemic. One of the reasons why I think a lot of journals have gotten things, like I'm not thinking about journals, newspapers too, have gotten stuff wrong, is if you look at the people who really understand disease outbreaks, infectious disease epidemiology, the Mark Lipschitz of the world, there's a variety of folks who are very, there's just broad agreement. Even when you look at their models disagree, they don't really disagree. They're just making different assumptions. And if they actually agreed on assumptions, they'd come up with the same answer. And we should just make that explicit to people. And there's not that much disagreement. What happens, and has happened in this case, and it's been hugely problematic, is a small number of academics who have essentially no business in this field because they don't really understand it. They will walk in, but they're like professors at Stanford, and they are very smart. And they're very good at what they do. This is not what they do. And they show up and say, I got a whole new theory. This thing is like milder than the flu. It could just be the common cold. And we're all looking going, it's not the common cold, trust me. But they're a professor at Stanford. And now it's gone from, now it's a debate between a Harvard professor and a Stanford professor. And a part of me is like, those of us who actually try to pay attention to the specific expertise know that this is not a debate between Mark Lipschitz and, I won't pick on the specifics, but like we know who the experts are and there is broad consensus, and where the experts disagree, it's because the science is not clear, and that's totally fine. But a part of it is this thing that a lot of folks do, and I see this in lots of things where people with credentials, but not in their field, will walk in and say, I'm an astrophysicist. I know how to think about this. And they get stuff wrong, and that creates this sense of we're just giving voice to both sides. And I don't know how journalists or op-ed pages can always adjudicate what is true expertise versus not. And they tend to say, well, he's a professor at Stanford. He probably knows what he's talking about. He does, just in a different field. So that's a huge challenge.
Yeah, and so let's go deep on on the huge challenge of credentialing here and expertise, because the Fauci moment that we're going through, and I think the Gates moment as well, is that sometimes there is interest in digging into and investigating the background of folks. And then there's instances where you just take it on faith that someone is who they say they are. So controversy that we were looking into over the last week or so was California having herd immunity, right? So there was a professor, or not a professor, he was an affiliate at the Hoover Institute at Stanford. A historian had said that there was a flu season, it was particularly bad in California, must have created the antibodies for herd immunity in California, because look, it's not hitting us as hard as other places. And having lived in California, I know that you spend most of your time in a car, not even at your house. And so it's not the same kind of density we're talking about when we talk about other places, except with the exception of probably San Francisco. But nevertheless, the affiliation definitely did carry with it the headlines, which said Stanford researcher says we must have herd immunity in California. We've also seen it with the hydroxychloroquine example, where the biggest booster of it when he was on Tucker Carlson, had this underneath the marquee said advisor to Stanford Medical Hospital's Spark program. And as someone who is an academic, I said, this doesn't refer to what he does, and therefore is very suspect. Once I started digging in, the next day Stanford said, we don't know who this person is, and we're not affiliated with this study. But you're right to say that experts are coming under scrutiny, some for good reasons, some for not. As a public health person, is there any advice you would give to lay folks who are trying to understand more about the evidence, trying to understand more about the science that's out there? Are there resources or places we might want to check into, or just some kind of advice on how to navigate this? For me, it was as simple as going on the Stanford website, looking for this person's name, not finding it, looking at the Spark program and what it did, and understanding that it wasn't necessarily medicine. But in this moment where the internet is really the central place for getting information, how do you wade through it?
Yeah. So one issue around the kind of expertise credentialing thing that I talk to my colleagues about in terms of how to communicate, and I'll get to your question of how can people do this, is I think it's really important for those of us in the public health sphere to understand what our own limitations of our own expertise are. So I am not an infectious disease modeler, and there is a set of technical expertise on that I do not have. And so when I get asked a question about, there's a new paper out of Los Alamos that says the R naught is actually 5.5, not 2.8, I'm punting on that question. I think that 5.5 is wrong, I think. But one of the key things is being very, very explicit about where your own expertise ends, because I'm A, likely to get into trouble and say something dumb, and B, I don't want to propagate misinformation, right? So, but this has been kind of one of the things I've been talking to a lot of my colleagues about, who are like, I'm not totally comfortable talking about everything. I'm like, you don't have to be. You have to be comfortable talking about the things you understand, and then drawing a very clear line that says, this is not what I do. One of the general kind of things that I would say about an outbreak like this and people trying to sort out expertise, it is hard to there isn't a great source. CDC was a great source. CDC used to be a place you could just turn to and know that you'd get really high quality evidence-based information. It sort of kind of still is a little bit, but they've really taken this pandemic off. And so they, as a source of good information for the American public, has been a massive disappointment. And so then you're like, should I go to my state health department? Most of them are not doing updating of that kind of stuff. So there aren't great sources. Hopkins is a great source for data, and there are a couple of others. I try to tell people that read Stat News because their editorial's excellent, but they've published a couple of things that I've been really surprised and disappointed by. So they're not perfect, but they're very, very good. One thing they published, I shouldn't beat up on them too much. One thing, but anyway, it's fine. But the other bigger picture point is that if you find one person who's completely cutting against the grain, be very skeptical, whatever that person's title is. Because while it is true that the narrative of the lone wolf scientist who proved the whole world wrong is great, it almost never is true. Mm-hmm. And the scientific consensus, while not perfect and a little slow and occasionally kind of a little messy, is largely right. And especially in moments of great uncertainty, it's very easy to be the kind of person who is the contrarian. So I always say, be careful of contrarians, be careful of the lone wolves. Unless you have deep expertise and can evaluate that person's content, I don't care what their credentials are, I'm going to be skeptical. And that's what I tell people, is to be skeptical of contrarians.
No, and I agree with you. And I think that that's actually Contra Journalism, which is in science, we want everybody to be writing the same thing, right? If you have studies in France that are being conducted and studies in Idaho, and you got people in India, and they're all coming up with the same conclusions, that's science. That's what's important, is that they're independent studies happening with the same methods that then reach the same conclusions. But that is definitely different from the way in which journalists want to seek out the novel and the cutting edge. And so we are going to be doing an episode of Big If True with some science journalists and popular science educators, just to get a sense of how this will play out. I wanted to talk a bit about what is public health. I probably should have done this at the beginning, but I think it's also important to mark as something different from what happens in a hospital, right? So you have doctors, you have medical staff, you've got nurses, you've got all these people who are in the moment handling emergency situations or providing patient care. But public health is, it needs everyone to be doing the same thing. We need everyone to be on board with the recommendations so that there's widespread consensus isn't the right word, but understanding about something like social distancing. For instance, I was walking down the street in my neighborhood just yesterday, and someone had decided that they were just going to jog by, and they were maybe less than a foot away from me and my spouse, not wearing a mask. And I just thought to myself, like, what world is that person living in that this doesn't matter to them? And I was kind of angry. I was just like, this ain't about you. This is about us. So how are we supposed to understand public health and the way in which people take up health recommendations, and what does that mean about the community aspect of participation? And then Setti, I'm going to go to you after Ashish to think about, what is the role of city governments in messaging it and reaching people? Ashish?
Yeah, so public health very much, as you alluded to, not even alluded to, you said, John, that it is very much about thinking about health of population. So you're not thinking about the health of each individual, which you do in clinical practice. I can't remember if it's like a line from Hopkins or something, but they're like, saving lives millions at a time kind of idea. That you're not trying to make individual change, though you have some of that in public health, but you're really trying to think about broader societal change. In that context, the notions around social contract really do come into effect in a very different way. That this idea that my health is better because of the actions of people around me. And actually, I often say the mask wearing thing that we've been telling people to do is like the ultimate example of that. Because if you're going to go out right now and go to a grocery store and you're going to wear a mask, it's not going to do anything for you. You're protecting everybody else. You're not protecting yourself. And if everybody else is wearing a mask, they're protecting you. And so it is the ultimate act of, I am doing this to protect others, and so others will do it to protect me, and everybody's better off for it, right? And if everybody individually thought, well, the mask doesn't do anything for me, it's a little annoying and a little uncomfortable, I'm not going to wear it, we're all worse off for it. So it's kind of the ultimate example of how collective action is so incredibly powerful in these moments. And helping, and I have found, there's always going to be the small number of kind of rogue individualists who are like, I don't care, I'm just gonna do whatever I want. But you don't need 100% compliance with anything. But we can usually get a vast majority of people, 80, 90, some odd percent of people who get that, who are willing to do that, who are willing to make the sacrifice because they believe everybody else is better off for it. And that sense of kind of collective action I find very powerful. And I do think, and again, I'm not gonna, Setti will really be able to talk about this, but I do think kind of a sense of kind of community and local, local connection and a sense that these people are my neighbors is an incredibly important part of that. And that really leads me to thinking about the role of local leadership in creating that milieu and that environment that I think is so critical to this. So I'm curious about Setti's comments around kind of local leadership on this stuff.
Sure. Well, as you were talking, Ashish, I was recalled in 2014 when we had someone in our community that was suspected of having Ebola. I was notified as the mayor, and there are three things that are so different from 2014 to today. One, first thing I did was I looked at the CDC and guidelines to see what my response should be. And it was reliable. The second thing I had that was a real asset that most communities don't have, my Commissioner of Health and Human Services happened to be a doctor with expertise around infectious diseases. So she was literally advising me and our team on an hourly basis as to what we should do. Second, we had a strong local newspaper that had reporters that people trusted, and they would pick up the Newton tab and they would see what was really happening, and they were putting content online. Three, particularly for mid to smaller size cities, not Boston. You know, Marty Walsh can call a press conference every day and all the networks will cover it. He'll be on the front page of the Globe and the Herald and all the rest. For other communities, they don't have the opportunity to do that. So a lot of times what goes on is it's word of mouth. It's people seeing each other on the soccer field. It's people seeing each other at the supermarket. It's people seeing each other at church, synagogue. And so people are having these community conversations about how we should respond, how we should treat one another, how we should think about this. People are not congregating, right? They're not congregating. They're isolated. They're talking to maybe their friends or their family, but they're not exposed to the community at large. One of the things that I felt so strongly about was getting out of City Hall and just walking in the villages and stopping in the shops and, you know, seeing the people. And I learned a lot from just listening to people, and that informed my decision making. That's a real challenge. So we're going to have to, leaders are going to have to figure out how to create that without having a, you know, staffed up, you know, Newton tab or local paper these papers are vanishing, without seeing each other at the ball game or the synagogue. They're going to have to, community leaders are going to have to figure out how to communicate to people. You know, we may find ourselves going away from technology and maybe putting physical signage up in and around communities. I mean, I remember when we had a water main break, and then at the same time in Newton, cell service went down. So I couldn't do a robocall to alert people. So we literally put signs up. We had a bullhorn, sound truck, and all these types of things. We may need to really rethink in the clutter of all the news as local leaders how to communicate with our constituents.
It's interesting that you say that, because we're going to wrap up soon here, but I just wanted to say that, yeah, there's been one story that's been a little too persistent online on television that I think actually is going to have the reverse impact, which is these drones that have been deployed in a small Massachusetts town that measure the distance between people and then say, you know, with a very authoritative voice that you're, you know, please practice social distancing. And then if you don't, they are going to send out police to the local park. And the use of drones in this situation, I feel like, is too militarized.
I agree.
You know, and this is the kind of pushback we're getting too about contact tracing. There is an article in The Hill. I will share it with the slides from some doctors and Mary Gray, an anthropologist, about how contact tracing can be done with respect to privacy. And I think that there are technological challenges that come up about the right technology, the right kind of communication, and not doing it in a way that you know, freaks people out. I mean, if a drone starts telling me what to do, I'm not going to like that, right? So I want us to be mindful of that. But one of the things that I've found heartening, at least in my neighborhood, is people are putting up little signs in their windows that are, you know, cheering people on about, let's get through this together. There's been ways in which people have been trying to raise the mental health of the folks in their neighborhood to give good tidings. I'm noticing people are starting to make more eye contact with each other on the streets. But when it comes to, billboards and activating signage, people are putting mutual aid signs in their yard. We have a pretty vast mutual aid network happening here in Somerville as well. So there's a lot to contend with when it comes to how you can get people the right information, timely local relevant and redundant. And I think that social media by and large is not helping us get through this moment, especially as public health advocates are just completely overwhelmed with the amount of information. And as Ashish has really pointed out, it's not just getting people the right information, it's also the resources spent on debunking and dealing with the misinformation to overcome the rumors. It's astronomical. And I've started to go back through our research and look at, week one, there's going to be, mass shutdowns in martial law. We get through that set of rumors, then we get to another set of rumors around, vaccines. And so it's going to be a really difficult and long process for us to get our communication systems in the shape they need to be. And I'm just thinking here more about how we will need to utilize mass communication strategies like radio and television, local news. I've found it a little disheartening that the president's presser happens during the midst of the 6 o'clock news hour when people should be tuning into their local news and hearing directly from, doctors and hospital representatives in their neighborhoods about what it's like to get through this. And so I just want to open the floor for any last closing thoughts here about, not going to ask you about the future and when we're going to reopen, because I think your guess is as good as mine. But I would love to hear about where you're going to put some of your attention over the next couple of weeks, and what are the kinds of things that you're looking forward to thinking about or researching, or what you're working on.
Let me just maybe start by saying one of the challenges of being an academic in this is, in academia, kind of new ideas are prized. Sometimes contrarian views are prized, right? Like you're the kind of the Lone Ranger who figured it out that everybody else was wrong. Mm-hmm. And certainly at a place like Harvard, I think like we tend to value that kind of independent thinking. And I've come to realize that there are a few basic points about this disease that most people need to understand. And I find myself in many ways repeating the same thing. And it feels boring, and it feels like I can't believe, but it's actually what I have come to feel is that it's one of the best things I could be doing, is staying relatively straightforward on where the science is, where the science isn't, not getting into a lot of food fights over the kind of distracting topic of the day, and just trying to stick to where what we know and don't know. And it's a little bit counter for kind of like the academic world, where again, every time I speak, I feel like I should say something new. And I realize I'm going to say the same thing I said last week, because it's still true. Social distancing is still very important. We still need to get our testing ramped up. We still need to get our healthcare system in good shape. That's when we can open up. Like there's just a series of messages, and it's a funny place to be in. But it also lets me get away from a lot of the misinformation and not have to deal with it on an ongoing basis. But I will say, just as a last thought, it does take a good chunk of energy, because I may say I don't want to do it, I'm not going to get into it. But the truth is, the journalist wants to, and a lot of journalists do, and they want me to address it. So in the middle of this incredibly complicated, difficult pandemic, all of us are spending 20-30% of our time basically trying to get people away from being distracted and just focusing on what's important. And that's time wasted, because I'd rather be doing other things.
Great. And Setti?
Just my final thought. I think there's a narrative out there. There's a little bit of a false choice going on about the economy versus health and opening up. I remembered when I was the mayor, we had a cluster of suicides in our high school. And I told the superintendent and all my team, we are going to spend whatever it takes to make sure we have the resources to stop these suicides from happening. I didn't set back and say, can we afford to bring in those resources? I see And I got a lot of research done from experts. I listened to the experts about how to stop it. We've got to attack this the same way. We've got to put all the resources we can into protecting people. And this virus has exposed the huge inequities in our society, not just, people's economic situation, but racial and all the rest. Instead of saying we got to get people back to work so they can make money and then putting them in danger, right? We should be saying, let's protect people. Let's give all the protections we can to people and then make sure they can take care of themselves and their families. Every public policymaker should be forced to be thinking about that at every level of government, as opposed to open up so that people can put food on the table, but then endanger their lives, or shut down and people can't make a living. So I think that's the direction. We've got to get our public policymakers thinking about that, not the one choices versus the other.
It's really great to think about. And this has been an incredibly fruitful conversation for me. I have a lot to think about, a lot of different ways that I'm going to come at this problem, and really just very thankful that both of you are thinking about these issues and are part of our community here. I just wanted to close by letting people know that next week's webinar is going to be on technologies of the far right. We're going to look at the technopolitics of facial recognition technologies, talking with Luke O'Brien, who recently put out a new piece for Huffington Post about Clearview AI, which is a big data company that has taken extraordinary amounts of data from social media from private citizens and have created a technology that they're selling to a number of different police organizations as well as governments. And he's going to be in conversation with Biela Coleman, who's the Wolf Chair in Scientific and Technology Literacy at McGill University. And the sign up for that is already in your chat. So thank you both for everything that you've done, and let's keep chatting. And for everybody else, I'll see you on the internet. Bye-bye.
Thank you.
Thank you.